Welcome to Integrity Linguistics Institute. Okay, so now I'm going to play the audio. Listen to the audio, type your answer in the chat box.
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you'll be completely diabetes-free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.
All right. So now, all right, so were you able to find the answer? I'll do one thing. I will play the audio once more and try to see if you're able to find the answer, right?
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you'll be completely diabetes-free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.
All right. So now, so what is the answer? Okay. All right. So it doesn't matter if it goes right or wrong. The most important thing is that you participate. Right. So the 27th question. So what type of question is this? So it is very easy. It is an attitude and reaction type question, right? Attitude and reaction type question. Right. Now, as you can see over here, attitude is what? Feelings, right? Emotions, right? That is what you need to first of all understand over here. Right. So now let's read the question over here. Okay. So the question is, you hear a dietitian. So who's the dietitian over here? The dietitian is the speaker over here. And you hear a dietitian talking to a patient about a new treatment plan for diabetes, right? So the patient is a diabetic patient and the dietitian is giving a new treatment plan for diabetes, a new plan for diabetes. So that is the scenario over here. Now, what is your duty over here? How does the patient react to the plan? Right. So from whose voice, from whom are you finding the answer? The patient, right? So the answer is going to come from the patient, right? So the patient's reaction. So when you're listening to the audio, to whose voice you should give more importance? The patient, right? The patient is the main speaker over here. So the main speaker over here is the patient. Okay, this is the one thing. So when you're listening to the audio, you must give more importance to what the patient is saying. Okay, and patient's reaction. Okay, so what is the attitude of the patient when they hear about this new treatment plan for diabetes? Right. Now, let's take a look into the question over here. I mean, the keywords over here. Answer option A. She is unsure. Okay, so before I talk about this, here there are 3 its over here. Now, can anyone type the answer in the chat box and tell me what does this it refer to? The OET likes to use these type of, replacements. Diet, plan, new treatment. Yes, very good. Okay, yes, fantastic, right? So here the it is referring to, okay, the it is referring to this new treatment plan. Okay, this is what it is referring to. It is not referring to diabetes and it is not referring to the reaction as well. Okay, so very nicely done. Now let's talk about the first thing over here. That is first answer option over here, which is she is unsure she's unsure whether she could manage it. Okay. That is, she is telling, I'm not sure. Okay. I'm not sure if I will be able to manage the condition. So maybe the dietitian is saying you cannot have ice cream for 3 months. So when she is hearing, oh, here, I cannot have ice cream for 3 months. Every day I eat ice cream. So I don't think I'll be able to manage it. So she's telling, oh, that this plan is very, very tough for me. Okay. This is very challenging for me. I don't think I can manage it. So she is unsure because she is saying it's too difficult for her. Answer option B, she wonders how effective it would be. Okay, so she wonders means what? She is thinking, she is wondering to herself, like how effective this new plan is. That is this plan going to be effective? Or, it is going to be, is it going to succeed or is it going to fail? So she is not certain. She is not certain whether this plan is really going to help her. Okay, so she is doubting the efficacy of it. Answer option C, she is keen to give this a try. Now, before we go to the audio, just by looking into these answer options over here, let's try to identify the emotions of the person over here, right? See, she is unsure about whether she could manage it. Okay, so what is the feeling that you get over here? Okay, so the feeling over here is, you can say she is concerned, right? See, what is the emotion? As I told you, you must be able to listen to the emotions and feelings. So see, the dietitian is telling you cannot have ice cream, you cannot have tea, you cannot have coffee for 6 months. So she is now very concerned. So she is very concerned. Oh my God, this is very, very tough for me. I don't think I'll be able to manage it. So what is the emotion over here? What is the emotion over here? It is concern, right? Now let's come to answer option B. So what is B option telling you? She wonders how effective it would be, right? So what is the emotion over here? The emotion over here is doubtful, right? She is doubting the efficacy. She's telling, is this plan really going to be effective? I don't think so. I don't think this is going to be effective. I think it is going to fail only. I really doubt its efficacy. So what is the emotion over here? She is doubting. She is doubting it. So doubt is the emotion over here, right? Now, what is the emotion in answer option C? She is keen to give it a try. So can anyone tell me what is the emotion for answer option C? She is keen to give it a try. What is the emotion? She's keen basically means what? Keen. Yeah, keen. Yeah, interested. Yeah. Is there like emotion, like interested? Yeah, very good. Excited. Right. So she is excited to start the what? The treatment plan. So the emotion over here is excitement. Right. Or we can say she is super enthusiastic. Okay, so she is very, very enthusiastic. Now you see over here, we do not even listen to the audio. Without even listen to the audio, we know the first concern is, for answer option A is concern is the emotion, right? For answer option B, the emotion is doubtful. For answer option C, the emotion is excitement. Now, don't you think it is going to be a little bit more easier? So now you see, this is why they give you 15 seconds time, right? Now they give you 15 seconds time. So now what you have to do now, when you're listening, all right, so now when you're going to be listening to the audio, you just have to match the feeling. Okay, so who's the main speaker over here? The main speaker over here is the patient over here, right? So now, even if you don't understand the language that they're saying, at least you try to match the emotion. So is the emotion is the patient expressing an emotion of concern? Is the patient expressing an emotion of doubt? Is the patient expressing an emotion of excitement? Right? So if you're able to make that connection, then this becomes a little bit more easier, right? So this is the strategy for this particular question. Right. So now, having understood that, what we are going to do is we are going to listen to take a look into the transcript, right? So we listen to the audio 2 times. So now let's just take a look into the transcript and let's bring in our elimination strategies and try to eliminate the incorrect answer options. Now, before we go there, okay, before I show you the elimination, the transcript over here, I once again want to talk about the 3 steps right? So step number 1 is comprehension of the question, right? Step number 2 is retention of the question to your memory. And step number 3 is finally what we call as the detection, right? So what is comprehension? Comprehension basically means understanding the question. Okay, understanding what your duty is. Okay, so here the main speaker is the patient. My duty is to find the attitude of the patient, right? So that is like this, you really have to comprehend and you have to like go through the answer options as well. Now what you need to do, you need to register this information to your memory, right? You must not forget what you have understood, right? So you must retain this into your memory. That is what we call as retention. Then you have to go and detect. So now you know, okay, now the emotion of the patient, the feeling of the patient, that is what I need to, match to. And then you need to go and detect and find the answer. Right. Now, one very important tip I want to give you is that when you're listening, right, when you're going to listen, that is after 15 seconds. After 15 seconds, when you're listening to the audio, your eyesight, right, your eyesight should only be in the answer options. Once again, I'm going to repeat. They give you 15 seconds time to read the question. So you have to comprehend the question. You have to retain this memory, you have to retain this information to your memory. Right. So comprehension, retention. You have a good memory of the question. That is how does the patient react? Now, when you're listening to the audio, your eyesight should only be in the answer options. Because when you're listening to the audio, if the student is reading the question, right? So when when instead of reading the answer options, if a student is reading the question when the audio is playing, they are not giving importance to the answer options. So what will happen? They are going to distract themselves, right? So the OET is trying to distract you. And what is going to happen? The student is going to distract themselves. And even if we become distracted for few seconds, like, even for 2 or 3 seconds, if our concentration goes away from the, answer options, that is enough. We may actually lose we may not be able to identify the correct answer. So don't distract yourself. When the audio is playing, your eyesight should be in the answer options, right? So let's just read the question once again. You hear a dietitian talking to a patient about a new treatment plan for diabetes. How does the patient react to the plan? Okay, she's unsure whether she could manage it, concerned, she wonders how effective it is, doubtful, she is keen to give it a try, she is excited, right? So now let's take a look into the transcript over here, right? So let's see what the transcript is saying. So here the dietitian is asking, so you're interested in trying a new way of treating your type 2 diabetes through diet. The diet would involve cutting your calorie intake down to 800 calories a day. So what is the dietitian telling? So remember when I told you the main speaker for us is the patient, not the dietitian, right? So this is background information for us, right? So here the person is saying, okay, there is a new way of treating your type 2 diabetes, and the new plan is to change your diet and you have to cut your calories to 800 calories per day. That is maximum 800 calories only you have to, eat per day. And she is telling, ooh, now you see, you must have able, no, she say, oh, that is not many. So she is telling, oh, that is very tough. Okay, 800 calories is very, very little, right? Oh, that's not too many calories, right? So now the person is saying, okay, so again, the emotions and feelings, it's not about the language, it is about the attitude, right? So now this person is saying, well, it would mean cutting out fat. Okay, so now again, the dietitian is saying cutting out fat, cutting out sugar, and just eating protein and vegetables. But the payoff basically means what? The reward. Okay, so the reward. Okay, so these are all synonyms. Okay, you must be able to understand, these type of vocabulary. See, for example, if if my staff is working very good, right, I will give them a reward, right? So the payoff is going to be a bonus in their salaries, right? So that is what is a payoff basically means a reward. So here the dietitian is telling, okay, the reward. So if you cut, so here the That is, if you cut out fat, if you cut out sugar, if you're eating only proteins and vegetables, I know it is going to be very tough, but the reward is you would be completely diabetes free. So what is the dietitian claiming? The dietitian is guaranteeing you will be completely diabetes free, right? So now what's the question duty over here? The patient's reaction, right? So now let's see how the patient is reacting to this. So the patient is saying, well, it does sound like a healthy diet. Now, see, the patient is saying, it sounds, okay, it sounds like a healthy diet. And I guess I ought to have a go. Okay, I ought means what? It sounds okay. And I think I should have a go at it. Okay, if there is a chance of beating the condition. So this is the person is saying, okay, if there is any chance of beating the condition is what? Diabetes. So beating the condition basically means what? Overcoming. Okay, beating basically means, overcoming diabetes, that is curing diabetes. So beating the condition means curing diabetes. So person is saying, okay, you are telling me that if I follow this new diet, I'll be completely diabetes free. So the person is saying, okay, it sounds like a healthy diet, and I think I ought to have a go if there is a chance of beating the condition. Now the person is saying, I just hope it's worth the effort though. So she's saying, I am going to invest the effort. Okay, I don't mind putting the effort, but I just hope it is going to be worth the effort. So, what is the emotion that you're getting? Are you getting excitement from here? Are you getting concern from here? It is a emotion of doubt. Okay, I just hope it is going to be worth the effort. Right? I mean, there is no guarantee. Now, see, the person is saying there is no guarantee that I won't still have diabetes at the end of it. Is there? Okay, so now see what is the emotion that is coming from the patient. The patient is saying, okay, whatever you're saying, it sounds like a very healthy diet, and if there is a small chance of overcoming diabetes, I'm ready to give it a try. But I just hope it is going to be worth the effort, because I am not believing there is a full guarantee that I'm going to be completely diabetes free. So person is asking, so can you really tell me that I'm going to have no bodies at the end of it? So now the person is saying, well, this is a new treatment. We wouldn't want to undertake it without some prospect of success. So now this person is saying, again, this is a dietitian. Dietitian, this is a new treatment. Okay. And if prospect basically means what? Chances. Okay. So you really have to understand, these type of words. Prospect basically means like high chance. Okay. So this is a prospective candidate. That means there's a chance of high potential. Okay. What basically means these type of words. That's a potential for success. Okay, so like that. Now, when you're listening to this, what again, so as I told you, they are going to be using completely paraphrased versions. So what is the emotion that you're getting from this part of the patient's response, right? Now, what is answer option A? She is unsure whether she could manage it. Okay, so did the patient tell anywhere that the patient is going to find this very difficult? No, right? The patient is telling, I'm ready to give it a try. Okay, I'm ready. Okay, if there's a chance of beating this condition, okay, I'm willing to put in the effort, right? But what is answer option A telling over here? She is unsure whether she could manage it, right? So she is the patient telling, oh, I will find this is too difficult for me. I don't think I'll be able to do it. This is very impossible for me. Did the patient say that? No. Okay, so this type of reaction we did not get from the patient. Right. So therefore, A is eliminated. Right. Now, what is answer option B telling? She wonders how effective it would be. Right. So she is wondering. So what's the patient's reaction over here? She is wondering how effective it would be. Yes. So she's thinking, okay, she's saying, okay, I know that you're telling this is a very, very super diet that is going to cure diabetes and all, and I'm going to put in the effort, but I really doubt whether it is going to be effective. I really doubt whether it is going to be worth the effort. So she is expressing doubt over here, right? Coming from that particular portion. So we can say that answer option B could be the correct answer, right? We have not yet eliminated answer option C. Now, what is answer option C telling? She is keen to give it a try. That is not there. Okay, so she is not super excited. Are we sensing a feeling of excitement from the patient? No, right? She is not all excited to do it. She is a little bit, okay, it's a very tough thing. And if this is my health, this is my body. So I have no other option. I will give it a try. So there is no sense of excitement. Now see over here, if the answer option is she is going to give it a try. Okay. To a small extent, it can be the correct answer. Okay. But over here, she is keen. So since this word over here is mentioned, that is not going to be the right answer over here. Excitement is not mentioned. Right. So we cannot choose answer option C as well. So what you can do, you can eliminate answer option C. So by default, so if A is eliminated and if you eliminate C option, then which is the remaining answer option that is left? The remaining answer option left is answer option B. Okay. So this is the patient's reaction. Okay. The feeling over here, the emotion over here is doubt over here. So now I'm going to play the audio once again, and I want you to listen to the tone of the speaker. Okay, that is, you must be able, not the English over here, but the tone in which they speak. Okay, that will reflect a doubt. All right, so let me play the audio once again. So read the question until then. So let me just take the question once again. Now let's hear the audio script.
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you'll be completely diabetes free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.